the first thing you have to understand is who really is your audience? Who are the people that you need to target? This is part of your prospecting. And other than who, where can you find them? Where can you direct them? During the 40s, the 50s, the 60s, 70s, you had radio. Then after radio, you had TV. That's where people were to view them. Or you had to go to big events, networking events. You had to go to the mall during the 80s and the 90s, right? But guess what? Nowadays, malls are closing down. Big box stores are closing down. Sears just filed bankruptcy a few weeks back. Everyone is hanging out in social media. Everyone is buying e-commerce. So the question is, you have to be able to know where to look and how to look for them. So before you go out sell, before you start, marketing your products, before you start, going out there and prospecting and presenting your services, before you go out there, the first thing you need to know is that you need to know your customer. Who are your customers? Know the people that's going to buy your services. Okay? Build a pipeline. And then you have to justify your value. So when we talk about know your customer, if you're in the medical, so of course your customers are going to be who? Not the patients directly. Your real customers that you need to sell towards are your social workers, the discharge planners. Then you need to be able to know the physicians, who are the gatekeepers. You need to know the assisted living communities. You need to be able to know the rehab facilities, the hospitals. Those are your customers, not the patients yet, because you have to sell first to them to get the referrals. And then you have to know what makes each one of them tick. It's different from what you're going to direct a rehab facility on why they want to refer to you to what a hospital wants to be able for them to refer patients to you. So you have to understand what makes them decide, what makes them buy your services, what makes them want to use your services instead of the other companies that's already servicing them. Building a pipeline. Everyone says, I want to be able to take care of all the nursing homes. And then when you ask that owner, that marketer, okay, tell me how many nursing homes are in your area, they can't even say that. Great. Now that you know that you want to target the nursing home, let me ask this question. How many of them have you visited? How many of you have inquired for them? They won't be able to give you the right numbers. A lot of the times the reason why we're not even creating success is because our pipeline is not filled. Our calendars are not filled. How do you know your pipeline is filled? That means your calendar is filled because you have appointments left and right. And if you don't have appointments, you're doing cold visits to these facilities. So once you know your customer, once you know how they make decisions to use your services, once you actually build a pipeline, then you must be able to justify your value on why they need to use your services. Justify meaning what they want in a company you actually have and even more.